All right, I think we'll go ahead and start. Hello, and thank you for joining today's HEI Energy webinar on social science and environmental health research collaboration. My name is Ayusha Ariana, and I'm the research assistant with the Energy Research Program here at HEI. I'd like to acknowledge my co-organizers at HEI and thank our speakers and moderators for joining us today. For some background, HEI Energy is an independent, nonprofit corporation chartered to provide policy-relevant, high-quality, and impartial science. We host educational events such as this webinar and fund research that is selected, conducted, overseen, and reviewed independently of our government and industry sponsors. So before we delve into the webinar, I'd like to make a few housekeeping announcements. So all attendees are muted with no audio for the duration of this webinar. You can turn on closed captioning for the event at the bottom of your screen to the right of the Q&A button. You can submit questions throughout this event via the Q&A function and can also upload questions from other participants that match your own question. All questions will be reserved for the panel discussion at the end of this webinar. This webinar will be recorded and posted on our website, and if you experience any logistical difficulties, please send a message to the host through the Q&A function. And we hope you enjoy this event. We will now welcome our first speaker, Dr. Jen Baka. Jen Baka is an associate professor of geography at Penn State University. She is an energy geographer studying how material, political, and environmental processes interconnect and with what effects in the context of energy development. She works on unconventional and renewable energy systems in both domestic and international contexts. An overarching goal of her research, teaching, and service is to develop strategies for reducing environmental inequities in energy systems. Welcome, Jen.
Yeah, thank you so very much, Ayusha. Are you able to see my slides and hear me okay?
Yes, perfect. Thank you.
Excellent. So I am going to stay honest and time myself a little bit, but thank you everybody for joining us this afternoon. It's really my pleasure to be here and to kick things off. What I'm going to do is talk briefly about a study that has been funded by the HEI Energy program that we're still conducting. And this is a study to understand what the links are between unconventional energy development and public health in an area of legacy hydrocarbon extraction here in Southwestern Pennsylvania. And for full disclosure, I'm the PI on the project and I'm a social scientist by training. And I'm going to review some results today of an attempt to integrate social science and geoscientific research. And if you have questions on the geoscience, I'm happy to do my best, but let's follow up online or offline with the hard geoscience questions, if you don't mind. All right, so the objective here is to work down in Southwestern Pennsylvania in this area of legacy fossil fuel extraction and to better isolate the impacts of unconventional energy development on potential water contamination. And what we did in this 3-county area, which are Beaver, Washington, and Greene counties, just outside framing Pittsburgh, was to combine community focus groups where we went out to communities and asked them, what are you seeing in terms of changes to water quality and public health since the start of unconventional energy development in the region? And then we use that to inform a geoscientific analysis of a large water sampling database. What we did for those community focus groups, we held them June and July of last summer. We held one per county. We had relatively good attendance in the post-COVID world. And this was our first attempt to do social science research out in the field again since COVID. And people were really willing to talk to us and to share their experiences of what they were seeing. And our overarching question was just to ask communities, what are you seeing in terms of changes to water quality and public health over the last decade or so? And then we coded those replies from about 7 hours of community focus groups. And we coded those replies to inform this geoscientific analysis, and we were looking through those transcripts for evidence on potential contaminants, pathways of contamination, and health effects. All right. And so just a little bit about this water sampling database. So we have access here at Penn State to a water sampling database of about 7,000 groundwater samples from around the state. Here they are here. The black dots indicate the groundwater samples. The blue dots are unconventional energy wells. And so we have 7,000 samples from about 29,000 groundwater sources across the state. And we took the data from the focus groups to inform a geoscientific analysis of this water sampling database to try to better understand this linkage between unconventional energy development and potential water contamination. All right, so just a little bit about the focus group work. So this has not been published yet. This is preliminary. So today we're not going to share our slides with you. If you want more information, please follow up with me after the webinar, and I'm happy to share the findings as we get them through peer review. But we're confident enough in our preliminary findings to share them with you today. So when we coded for evidence of potential contamination, communities across the three counties were largely concerned with the waste disposal and storage phase of unconventional energy development. So that's with the wastewater after the fact, after fracking has been completed, what happens with those large volumes of wastewater that are circulating in communities, right? So that was the key area of the process of concern. And then in terms of actual contaminants, there was a lot of discussion about potential radiation contamination because the Marcellus Shale, which is where this area, Southwestern Pennsylvania, sits over, the Marcellus Shale has a lot of naturally occurring radioactive materials down in the subsurface. So there's concern that the fracking process, unconventional energy development, might be bringing some of that radiation back up to the surface and possibly contaminating waterways. So that is something that communities expressed in 2 of our 3 counties. And then the health effect that was on everybody's mind was potential cancer, because if there's concern about radiation, that of course dovetails into possible cancer concerns. And it seemed that everybody had a story of a rare cancer being experienced sometimes by them or by a close relative or family member. We were about 1 degree of separation from somebody who had a cancer story that they brought to these focus groups. All right, so we took that data. So we're concerned about potential wastewater management, radiation, and cancer as a public health impact to inform the geoscientific analysis of that water sampling database to see what we can do in terms of understanding these concerns and whether they link back to unconventional energy development. All right, so just a little bit on this groundwater sample, the database as writ large. So these samples were provided to us from the DEP. They are pre-drilling samples. Pennsylvania does not right now require post-drilling samples. I learned that Colorado does require pre-drill and post-drill samples. But because of the concentration and rapid expansion of unconventional energy development in Southwestern Pennsylvania, we can conceptualize this data set as both pre-drill and post-drill, because the drill for the next well downstream might be capturing impacts from the last well drilled up the stream, if you will. All right. We don't have samples for radiation directly, and that's not because of laziness or dereliction of duty on behalf of the DEP. It's really hard to get a lab up and running to test for radiation. But the important thing to keep in mind here, and this is something that we'll be bringing back to the communities when we do some follow-up work with them, some of the species in the database, so some of the analytes, can function as tracers for potentially hazardous species such as radium, arsenic, cadmium, and thallium. Okay, this is my social scientific hat here. But there's a lot of chloride, barium, and strontium in these water samples. Those are species that are commonly tested for in these DEP-approved labs. And this is my social science hat. These species don't like to live in isolation. They like to bond to other things. And so that's why these 3 elements are good tracers for potentially hazardous species, okay? And these things are commonly found in the produced waters of the Marcellus region. The produced waters are some of the waters that come up after a fracking process is completed. And just for reference, these produced waters are about 7 times more saline than the ocean. All right. And when we were analyzing the prevalence of these species in our study sites, Beaver, Washington, and Greene counties, we find that there are statistically significant positive correlations in select hotspots, primarily in Washington County here, where there's positive correlations between the prevalence of chloride and proximity to an unconventional well. All right, so these areas that are deep red, those are the hot spots that we identified just by looking at a ratio analysis of the amount of chloride found in these species. All right. And we think that what explains the prevalence of the chloride samples or of these species in the water samples, it's the brine salts coming back up whole, okay? So what we have here, again, is our map of the unconventional energy wells and the history of energy extraction here in Pennsylvania, and the log concentrations in relation to density of the unconventional energy wells across Pennsylvania, just up in the northeastern part of the Marcellus, and then down in southwestern Pennsylvania. And we find that there are statistically significant increases in the concentrations in barium and strontium in southwestern Pennsylvania and in Pennsylvania as a whole, but not statistically significant correlations in the Northeast Pennsylvania region, which does not have that same legacy of oil and gas extraction as the Southwest. Okay, and again, we're concerned about barium, strontium, and chloride because of their abilities to be function as tracers for pulling up some other contaminants that might pose a public health risk. All right, but as you're seeing, there's a lot of activity that goes on down in southwestern Pennsylvania. We have legacy coal mining, conventional oil and gas drilling, and then we also use a lot of road salt here in Pennsylvania to treat the roads in the winter. How can we better isolate an effect of unconventional energy development on these increases in concentrations that we're observing? So what we've been doing is some regression analysis using fixed effects, where we put in control variables for legacy oil and gas extraction, coal mining, proximities to highways, and the season in which these water samples were taken. And we are finding that even when we do those controls, we are still finding statistically significant impacts, statistically significant correlations between the species of interest and correlations with the number of unconventional energy wells drilled in southwestern Pennsylvania. All right. In interpreting these econometric results, we're finding that this translates into about a less than 15 microgram per liter increase in barium and strontium per unconventional energy well drilled within 1 kilometer. And just to put that into the health perspective and going back to the focus group analysis, even with this very high rate of unconventional energy drilling, the chances that these salt species are bringing up radioactive species that would exceed an EPA limit is unlikely. All right. Now, what part of the unconventional energy development process might be responsible for these increased concentrations? And so for this, we're looking at some of the violations that the DEP has kept track of over the last decade or so. And we're finding that it's largely the wastewater management side of the process that might be responsible for these increased concentrations that we're seeing. So what you see on these different graphs here are the types of violations that the DEP keeps track of, and then the increase in concentrations. All right. And so we have this for barium and strontium, and the dots that are colored in, that means that it was a statistically significant correlation, and the ones that are hollowed out, that was not a statistically significant correlation. And these graphs are for the statewide database. So it's not isolated just for southwestern Pennsylvania, but in our analysis, impoundment violations, that was statistically significant for strontium in Southwestern Pennsylvania. All right, and then impoundment is when the water is left on site in above ground storage pools. Okay. And then we're again trying to hone in on what part of the process might be responsible for this. And we looked at this another way in terms of violations that the DEP has kept track of for spilling wastewater across the state. And so that's what this map is showing us. So we have the locations of the unconventional wells, and then mapped on top of that are spills of wastewater at the 500 and 1,000 gallon levels. And we're finding that we are seeing small but statistically significant increases in barium and strontium in relation to these areas where violations have been documented. Okay, so again, we're honing in on wastewater management as the most likely or as the most probable contamination pathway here. All right, so going forward, as you can see here, we are showing some statistically significant correlation in select hotspots for increased correlations between different species in the produced waters and proximity to the unconventional wells that have been drilled, but we haven't been able to finish our analysis just yet on potential exposure analysis, right? So there's a lot of talk about cancer from the focus groups. What we're doing now in those select hotspots that we identified, we're looking through turnover in housing stock. So how long have people lived in the area? And that will be a nice proxy for us to see what kind of health effects might have been experienced in these very small handful of hotspots. We're going to go back out this summer to do a second round of focus groups. I'm just about at time. I'll wrap up soon, Ayusha, so thank you. We're going to do a second round of focus groups to share these results back with the communities and to get their feedback. And then we're going to also develop information sheets to pass along to community groups that weren't involved in our study per se, but still might be interested in this analysis. And then in terms of steps for research going beyond this study, communities would really like to have more data and testing for those radioactive elements that might be coming back up in the wastewaters. They would like more research on cancer and its linkage to unconventional energy development in the area. And then they really want to better understand this linkage between wastewater management and possible contamination and public health impacts. All right, so that is a broad overview of this study so far. I look forward to the rest of the webinar. And if you have additional questions, please ask questions during the webinar, and I'm happy to answer questions offline as well at my email. All right, and thank you everybody so much.
All right, thank you so much, Jen. Our next speaker is Dr. Stephanie Malin, who is an associate professor of sociology at Colorado State University. Her research interests include environmental justice, health, and governance in extractive communities, as well as in communities building more distributive and regenerative economies and systems. Stephanie is the co-founder and co-director of the Center for Environmental Justice at Colorado State University. Her most recent book, Building Something Better, Environmental Crises and the Promise for Community Change, with Megan Elizabeth Coleman, was released in 2022. Welcome, Stephanie.
Thank you so much. Thank you for the really interesting presentation, Dr. Baka, and I'm excited to share a little bit about some community-based work that we have going on here in Colorado. I'm going to share my screen and just wanted to make sure that everyone can see the slides. Does that look okay?
All good.
Wonderful. Excellent. So I am also going to time myself, so let me get that going so that I don't run over. So again, my name is Dr. Stephanie Malin. I am a social scientist here in Colorado, and I do mostly community-based work. And the study that I'm going to talk about today is probably the most comprehensively community-based that I've study that I've participated in, even with that track record. I was very honored to be invited on by various community organizations back in the grant writing phase. So today I'm going to give a little bit of an overview about what we're examining in this AIRE study, some of the demographics of the folks we've been interviewing and talking to, preliminary findings in this context of oil refining and community well-being and environmental justice. And we'll also, of course, be looking at, let me move that for us, highlighting our findings with representative data. And I'll be happy to answer questions during our Q&A at the end of the session. So before I start talking a little bit about what we're doing, our methods and our findings, I just wanted to highlight that I am one of the leaders of a bilingual, bicultural research team that we have gathered together so that we can be as community-based as possible. And also, before I even get into identifying my teammates here, my research teammates, mentioning that Cultivando, which is a Latin environmental justice community organization in Commerce City, Colorado, they're the community organization at the center of all of this. And so they chose myself and Dr. Ramona Beltran to run the study and invited us on the grant during the grant writing phase. And so again, this was a chance to work in a really reciprocal and deep way with community groups. Dr. Ramona Beltran is an associate professor at the University of Denver. We also have two research assistants, Mina Nunez Solis and Emilio Rivera, who have been with the program or project since last summer, and Aaron Palma is our project manager. So in this study, which is examining quite a few things, my particular team that I'm leading that we just saw there is looking at the social, environmental justice, and health effects of living or working near the Suncor facility. Now, the Suncor facility is the only oil refinery in Colorado. It is one of the biggest polluters in the state, and it consistently operates without many of the permits that are necessary to operate in the state of Colorado, which is kind of an interesting conundrum, to put it mildly. In 2019, the facility had one of what have become regular occurrences where they released a bunch of effluents into the community. And in this particular case in 2019, there was so much and it was so dense that the pollution kind of rained down like snow on the community. We have a photo voice component of the study I'll talk about in just in a few moments, but we've gotten many pictures of the event. Folks who watched it described it as a big orange cloud that appeared above the enormous oil refinery and then kind of moved its way towards Commerce City and schools in the area and things like that. This was one of the biggest and most visible violations of the facility. They have them a lot. There are frequent accidents. In fact, a big part of the facility has been shut down since December of 2022 due to accidents and fires and things like this. So from that 2019 accident, the state fined Suncor $9 million, and part of that money went back to Suncor to make improvements in their facility, but part of it also went into the Colorado Department of Public Health to fund community-based work on the impacts of the facility. We, as part of the community group that organized this grant, submitted a proposal and we got about a $2 million grant to look at a variety of things. So how that facility is affecting folks' daily life, especially their daily quality of life. What does it mean for their stress levels to live near a facility that pollutes so regularly and is so close to their homes and their schools? What are the health, environmental, family, and community impacts? How might the institutional context and the environmental health context relate to people's feelings of powerlessness? And then I also would have to mention, and I would love to field the questions that I can on this as well, even though I won't be focusing on it in the presentation. There's a large component of this interdisciplinary study that is looking at air quality impacts of the facility and doing pollution monitoring. This part of the study is led by Detlev Helmig, who is an internationally renowned air quality scholar. And we have both stationary and remote as well as mobile air quality monitoring units. And Cultivando, the community organization at the hub of all this, also received an EPA grant to do their own air quality monitoring as well. So there's a really robust part of that study going on. It's been well publicized since we had a press conference in March of 23, so earlier this spring. And there has been some really important findings in terms of elevated levels of various volatile organic compounds, or VOCs, as well as including benzene and other contaminants that folks shouldn't be exposed to at any level. What's unique about this study, given the volume of air monitoring that we have going on, is that instead of averaging things out over a week or a month, as EPA statistics tend to do, and state statistics tend to do. There's more of a real-time kind of assessment of what might be spikes of certain pollutants in the air at given times, which gives a much more accurate and kind of minute-to-minute representation of what folks in community experience in terms of air quality effects. So I'm happy to answer more questions about this, but I'm going to give a little bit of background on our timeline and how this was community-based throughout, from its inception to its implementation. And then I'll talk a little bit about our preliminary findings. Again, we are just completing our data analysis and coding and things like that. So these are really preliminary results, but I'm happy to answer any questions on those. So the grant was written and awarded in summer 2020 into fall 2020, and began with Zoom calls and community-based design meetings to which I was invited, right? Given that folks in Commerce City were very concerned about the impacts, and my ongoing work in oil and gas production had put me on their radar. So this began with Zoom calls kind of in the thick of the pandemic, and we all decided that a collaborative application was what we wanted to do, an interdisciplinary application, and we were awarded that. And I want to mention too at the outset that Cultivando is an organization that is working not just on this environmental justice issue, but many, given that Commerce City is one of the most polluted cities in the United States. Commerce City and the part of Denver that the facility is around in fact, is the most polluted zip code in the US. So Suncor isn't the only facility that is of concern here. There's a Purina dog chow factory. There's a meat refining facility. There is a water treatment plant and many other kind of layered sources of risk and pollution. But we were focusing on Suncor given that context that I mentioned before. And once we received the notice of the grant, we designed our study around what community wanted us to look at, particularly on the social science part of the research, as well as where air pollution would be monitored, who would be monitoring it, and how that would be done. Our portion of the study focused on doing in-depth interviews. We have completed about 57 at this point, participant observation. So this meant spending a great deal of time in community, also working with Cultivando to go over what community would like to have answered as we developed our interview guides and the kind of framework for our participant observation. And we decided to collect visual and archival data as well. I'll get into that a little bit more in a moment. We piloted this and we studied whether or not these questions, especially our interview guide, would be useful to members of community by working with a team of promotores on the interview guide and really painstakingly going through and trying to make sure that questions were worded in ways that were accessible and that, again, addressed issues that were of interest to community, not simply academics. There were multiple stages of this as we created sampling strategies, reworded questions. We asked about things that members of the research team may not have been aware of, for example. Our data collection began in late spring 22. We are completing a few of the interviews, but most of them have been transcribed and translated. Most of the interviews were done in Spanish, given the demographic makeup of our population, and the photo and visual data is occurring, collection is occurring right now. We are working on these interviews being transcribed and translated and going through and coding them now. And this is where we get the demographics and also some of the preliminary data I'll talk about. About 67% or 70% of our interview participants have come from the Commerce City area. About 25% are from another area of Denver adjacent to Commerce City called the GES area, or the Globeville-Swansea-Elaria area. And this is one of those spaces I've mentioned who's in a zip code space that has been notoriously kind of targeted as the site of locally undesirable land uses. They historically also sit on things like the Rocky Mountain nuclear arsenal, and there's also a lot of chemical weapons that have been incinerated and buried in the area as well. So this is one of many environmental risks. The rest of our interviewee population are from other metro areas within about 3 miles of Suncor. As you can see, we have mostly Hispanic, Latino, or Spanish descent participants. 12% are Black or African American, 17% are mixed race, and 2% identified as white, as well as 2% identifying as Native or American Indian. 76% of our participants have been identified as women, 17% as male, and 5% as non-binary. 43% have some kind of schooling, but less than a high school diploma. About 40 have a high school diploma with some college, and only about 18% have a bachelor's degree or higher. So this just gives you kind of a sense of whom we're talking to. And most of the folks that we've been interviewing are folks who live right near the facility and have been part of our network and propulsive sampling, as well as folks who may live outside the community but work in the community, such as teachers and nurses working at schools right near the facility. We've used in-depth interviews, participant observation, and ethnographic fieldwork that's still ongoing, as well as photo documentation and narratives written by members of community. And this is in a process called Photo Voice, for those of you who might be aware of work by folks like Shannon Bell. So I'm going to give examples of some of our preliminary findings in the next few minutes, and also give the English versions or translations of representative quotations, just to give you a sense of the narrative going on behind these rather clinical ways of talking about some of these preliminary findings. One of the biggest findings we've had, and this has emerged in almost every interview we've done, as well as field work, people are experiencing chronic negative impacts to their daily quality of life. Folks have to open windows because many of these households don't have air conditioning, and they are sitting in the middle of constant stink and pollution, not only from the Suncor facility, but from the Purina facility I mentioned before, and the many other sources of industrial pollution around them. So given that inability to protect their family's health, their inability to even go out on the front porch or play in the yard or open their windows without feeling at risk, folks experience these chronic negative impacts to their daily lives, and they're inescapable. There's a lot of disinformation or lack of awareness about the Suncor facility and what it is done there, which has emerged as a pretty surprising finding. And there are concerns about impacts to the health of vulnerable populations, especially children. In one of the English translations here, one of the mothers that we interviewed is talking about impacts to her children's health. And she says, in fact, one of my children, the eldest, surprised me when he told me, "Mama, they're practically poisoning us." She laughed and then sighed. For example, my other kid was always suffering from dry skin. And there was about 4 years ago that it seemed very strange to me that 3 of my comadres were pregnant and suddenly lost their babies. You know, there are a lot of children here or people with asthma. So this is representative of the sort of stories that we would hear from folks in terms of chronic stress over concerns about their children's health and exposure, as well as deep feelings of responsibility for that, given that folks don't have the ability to move out of the area. There's the Spanish translation, the original from the interview as well. Other preliminary findings that have emerged from most, if not all, of the interviews are consistent concerns over water quality and contamination. We would often do interviews in people's homes where almost all of the water that they would use were gotten from these water stations that are around Commerce City, where people go fill up their jugs of water to drink, but also to cook and to bathe and other things. Even teachers in the schools would talk about how they're told from the beginning, from the first day they start in schools, not to drink the water. There is chronic stress due to noise and traffic, as well as releases and risks from the facility, and the use of economic dependence or environmental blackmail on the part of Suncor to force support. And you even see this in some of the media coverage when Suncor shuts down or has delays in terms of it being the only oil refinery in Colorado. In terms of the water, here's a really powerful and important representative quotation. Regarding the water, it is very dirty. The water is dirty. It even smells different than anywhere else. Since we arrived here, we buy bottled water. We go to buy and fill our gallons and bring it home, and it is the water that we use to drink. It was much better in Aurora, which is another city outside of Denver. Even in the kitchen faucets, the bathrooms, the shower get dirty sooner. One has to be cleaning them faster. And there's the original quotation. Finally, we're seeing strong senses of fear and dread that have emerged in interviews with people aware of what the facility does, fear of accidents at the facility, but also fear of the chronic exposure to pollution, and awareness of structural vulnerabilities like immigration status or persistent poverty that keep people from speaking out, from moving away, or from organizing around their concerns. So we have found significant early evidence of negative impacts to quality of life and to stress levels, feelings of fear, disempowerment, and lack of access to useful information. All, especially that last part, really represents the procedural injustice components of this, right? That means that people don't have the ability or opportunity to meaningfully participate in making decisions about things like the Suncor facility's proximity to their homes. its ability to operate without a permit, for example, and specific concerns about water quality and multiple kinds of environmental exposures and health effects. Like Dr. Baka, I'm happy to take questions during the Q&A. I'm also more than happy to discuss things via email. So there is my email at Colorado State. And again, just a shout out for the Center for Environmental Justice that I co-direct here. You can also contact us there if you're if an EJ priority area or have interest in more general EJ concerns. So I will go ahead and stop sharing. Thank you so much for the opportunity to present.
Thank you so much for your presentation, Stephanie. So we have our final speakers now for this webinar, and they are the co-founders of the Environmental Health Steering Committee in the Crow Reservation in Montana. They are Myra Lefthand, Mari Eggers, and John Doyle. Myra Lefthand is a traditional Apsaluke Crow woman and fluent speaker of the Crow language. Myra earned a master's in social work and has 30 years of professional experience in healthcare, including as the longtime community health educator with the local Indian Health Service Hospital. She has served on the External Advisory Committee for the Center for Native American Environmental Health Equity, and also served as the Crow Tribal Courtlay Advocate and the Crow Court of Appeals Commissioner. She is an advocate for reducing violence against women and is currently the Chief Judge of the Crow Nation. Dr. Mari Eggers is an Associate Research Professor in Environmental Health at the Montana State University, Bozeman. She previously lived on the Crow Reservation, where she taught science at the Tribal College for a decade. Through the Crow Environmental Health Steering Committee, Mari has been working since 2006 with Crow colleagues and others on community-engaged research and capacity building to reduce tribal exposure to waterborne contaminants, improve access to safe drinking water, and to understand the impacts of climate change on water resources and community health. And finally, John T. Doyle is a member of the Apsaluke Nation in Montana. He has served as a county commissioner in Bighorn County for nearly 24 years and has served in many capacities to improve access to safe water and to improve the water conditions on the Crow Reservation. He currently serves as a chair and director for the Apsaluke Water and Wastewater Authority and has been and continues to be the principal investigator for many projects to research and address water issues on the Crow Reservation. He is also a founding board member of the Plenty Doors Community Development Corporation and a current member of the EPA's National Environmental Justice Advisory Council. Welcome, Myra, Mari, and John.
Thank you.
Thank you.
Thank you.
Can see our presentation here, us okay?
Yep, looks good.
Okay, take it away, Myra.
All right. Aho, thank you for allowing us to share what we have done for the Apsaluke people on the Crow Indian Reservation. Our reservation centers in our tribe's original homelands. We have about 14,000 people that live here on our reservation. This is our home then, and now it's still our home that are located along the rivers. We have had home wells and indoor plumbing that was done by IHS in the 1960s, so it hasn't been that long since we had indoor plumbing. But during that time, we have survived with the water, and it is one of our most sacred water that sustains us. And so when we had originally started with our committee, we wanted to preserve the water because it was getting contaminated. That's where we started with our committee. If you look on the right-hand side, that is the Crow Reservation. It's 2.3 million acres. We are a land-based tribe. Next. When we first started this committee, it was back in 2005. We started the Environmental Health Steering Committee with just 3 of the co-founders, myself, John, and Mari, and then we included other members that came along. After a week's work, we prioritized water contamination as our most serious environmental health issue. We started with working together with Mari as our scientist and for me and John as community members, because we were concerned and how the water is getting polluted. Our belief is that Western science is the exact same as community members. When we grew up in our homes near the river, as you can see on the picture on the left side, that is what happened all these years, and we still continue to do it with the picture on the right. So we realize that we need to preserve it for our children and our future generation. So we set our own research priorities, community members, and academic support partners for this research expertise. We have identified that both qualitative and quantitative work together, and that is what sustained our committee. Next slide is our Environmental Health Steering Committee, which is from 2005 to present. We have community-led participatory research, our Environmental Health Steering Committee, Little Bighorn College, Absalogay Water and Wastewater Authority, Plenty Doors, which is a development corporation, Montana State University, and other collaborators that we have that have helped us in our quest to address our water contamination. And in our culture, a lot of it depends on our land, our relationship to our land. We are also connected to our land. In the old days, it was the buffalo and the elk, the animals for everything, and it's still like that. We are tied closely to the land. That is our most prized possession, as well as our sacred water. We recognize connection between water and community health. We form the Environmental Health Steering Committee to address water contamination and health research and mitigation of river, springs, and home wells since 2005. And one of the new things that we have identified is how climate change is impacting surface and groundwater. And we are also collaborating with mentoring tribal college and Montana State University Crow research interns. We are collaborating on youth educational programs in our local schools, sharing research results with the community, primarily one-on-one. And I think that is one of the best things that we have done. That is the research that we have done, providing the community with the information so that they can also do what they can to address their water issues.
Thank you, Myra. I'm just going, Mari Eggers, Montana State University, and as Myra mentioned, long time partner of Myra and John's. I'm not going to go into depth in any of our research projects. I just kind of want to give you an overview of what we've been working on. And this is all published, and there's a list of our publications in a later slide if you want to learn more, or you're welcome to email us. But we started out really working on river contamination because we knew that, you know, there was a lot of evidence, just anecdotal and obvious to us, that the water quality was getting worse and that microbial contamination was an issue. And we're able to get enough data to allow support the Tribal Water and Wastewater Authority to apply for grants and funding to upgrade water and wastewater infrastructure on the reservation. John Doyle really helped lead that effort. He's one of the critical people, and they've raised more than $20 million to do all kinds of upgrades on the infrastructure, but they needed the data. You know, without that data, they would not have been able to get this funding. And then we kind of shifted to working on contaminated home wells. And this map of the reservation here shows the degree of risk from lifetime consumption of home well water. And anything that's yellow, orange, or red is increasingly unsafe to drink. Following the methodology that the USGS uses to assess safety of drinking water. So you can see generally home well water is really poor quality throughout the reservation. And then following this, we realized that there were a lot of other ways that poor water quality was affecting families beyond just doing this quantitative assessment by Western science. And that's where we brought in both social science expertise in terms of qualitative research. Both Myra Lefthand and Christine Martin on our steering committee have masters in social science and qualitative research expertise. So we've kind of combined both community knowledge and traditional knowledge of the environment and ecosystems on the reservation with qualitative science methods to understand that and to portray what's going on in other ways that poor water quality and water insecurity are impacting families. We've used a similar strategy in understanding impacts of climate change on water resources, both combining weather station data as well as interviews with elders across the reservation. I'll let John talk a little bit more about that research. And what we're doing now is collaborating with the USGS to understand organic contamination from pesticides to PFAS to, things from oil and gas development and spills of water resources. And we're also working with Rocky Mountain Labs, which is an NIH facility in Montana, to do a better understanding of waterborne pathogens across the reservation. So in short, I think this is not just Western science, not just quantitative methodology and social science methodology, but really it's also a huge amount of community expertise and community knowledge of the environment. And with that, I'm going to turn it over to John. John, you need to put the camera back on.
Good afternoon. My name is John Doyle. I'm a member of the Baka Nation, live in Crow Agency, Montana, and have been involved in addressing our water needs and problems for probably 40 years. And there's a lot of history and knowledge that's come along in those years. But I'm going to kind of be brief as some of that stuff that we've been a part of. And as you can see, that slide there shows climate change, water, and health. Well, for nearly 45 years, our tribe has been energy producers, and primarily the product was coal. And that has been the basis of our economy for that many years as well. And as that coal industry fades away because of climate change, our economy is the one that has been affected pretty strongly. And so we're in a transition period from that time of income to a time of very, very limited income. But that hasn't changed the condition of our water. And in that period of time, if anything, we may have seen the water conditions decline. And as it declined and there was very little resources to really address those the fixes and changes, but all the time observing what was going on and not finding any assistance to address that. And when the steering committee initially started having conversations, it was obvious to us that when we're making our presentations to find funding, that we didn't have all of the science that we needed to support our beliefs. And so on the left, you see a flood of, that's 2011 flood. In all of my memory prior to that, the only time there was a flood is if there was an ice jam, and it would back up in a pretty localized area. But, you know, in the past dozen years, we've had 2 major floods, and 40 years before that, we had another major flood, 500-year floods, 1,000-year floods. Right now, today in our little Bighorn River is bank full, and we're like 4 inches away from breaching that bank. And if we get any more rain today or this week, we may be back to that square one. But what that does to our community members or their wells are affected. And I don't know how many wells have been, were affected in a sense that the water breached their well casing. And so that became another whole issue. And in some cases, those wells weren't shock chlorinated, and people continued to use those waters. And, you know, with no really concern or any research that done any of the investigation to see if there was contaminants. When the steering committee started finding funding, then we started finding that there was contaminants in those wells, and some of it had been there for a long time. How many people's health had been affected by them contaminated waters is anybody's guess. But we tested probably nearly 300 wells over the period of time that maybe the last 10 years. And 2/3 or a third of them are contaminated with coliform or bacteria. So that started us on another whole investigation on, is there cross-contamination from septic systems that are at capacity? Because most of our family homes are rural family homes or large populations in those homes. 10, 20 people is not uncommon. And so along with that declining revenue becomes less of an opportunity to fix some of those problems. So the problems discontinue. Many people travel with just milk jugs and gallon milk jugs in their trunks, just so that when there's good water available, they always have some extra that they can bring home. The steering committee, in their effort to address some of that, has been to provide water dispensers, the coolers, so that they can at least have drinking water and cooking water. But really, our situation is pretty tough. And like Maury pointed out, our current investigation is with USGS. And today I was out visiting with homes 100 miles round trip for that trip today, just to make sure that our tribal members have the opportunity to have their wells tested, so that there might be a way to address their issues. And almost all of our collaboration with our community members is one-on-one, and it's going to homes and knocking on doors. So that means a lot of traveling. But part of the story is also is the realization that maybe there's so much to do, and as Myra pointed out, and you know, we're well aware of it, that we have years on us involved in it, but it's going to take many more years to really address all of the critical issues that are confronting us. So as you see the photos there, the young people, that's where we're turning to, is mentoring those young kids to be those leaders and address some of those issues that will probably still be there when they're our age if we don't find solutions. But they're our future leaders, and we recognize that. But we also have, like Mara pointed out, that we have many students with us that are college students and graduate students, and you know, we have high hopes for their continued participation, and they're not lured away to another location, that we have things for them to do and be involved in. But when life is tough here and there's no jobs and no income, then maybe moving away looks like it's a pretty good option. So while there's 14,000 of us and we're in our original homeland, we're also in a large part of South Central Montana. Billings is our largest city. That's also the job market. And so we have a moving population. It's almost as if we're still moving can't. Well, but we're moving for jobs now, almost like climate refugees. In a sense, it is because of that changing economy. So in order for us to get to where we've been or are right now, it's taken a lot of collaboration from many different groups. And so, like I said, the story is a long story. There's a lot of history in it, and very little time to share it with you all. But if there's any way that I can answer questions, I'll be happy to do so. Thank you.
Thank you so much for your presentation, Myra, Mari, and John. So we're now going to be moving to the panel discussion with all of our speakers for the last 20 or so minutes of this webinar. We have two moderators for this discussion, Julia Haggerty and Donna Voorhees. Dr. Julia Haggerty is an associate professor of geography in the Department of Earth Sciences at Montana State University, where she holds a joint appointment in the Montana Institute on Ecosystems. She also leads the Resources and Communities Research Group in studying the ways rural communities respond to shifting economic and policy trajectories, especially as they involve natural resources. Dr. Haggerty has expertise in diverse rural geographies, including those shaped by energy development, extractive industries, ranching and agriculture, and amenity development and conservation. Dr. Voorhees directs the energy research program here at HEI. And please feel free to send any more questions in the Q&A box, and we will do our best to get to them. Over to you.
Thanks so much, Ayusha. And I really want to thank all of our speakers, terrific presentations, and we appreciate you sharing your experience and your wisdom with our audience. We have a little bit of time, but not a lot of time. I want to ask one kind of overarching question of all of you, and ask you really to reflect on your experience with your interdisciplinary collaboration, and highlight for our audience, many of whom are conducting the kind of research you're conducting, highlight for them how you think the interdisciplinary collaboration most benefited your research. I think that's probably the most important lesson that people can take away from this. So I guess I'll go in the order of the presentations and say, Dr. Baka, start with you.
Yeah, thank you. That's a really good question to get us started off with. So I'm the social scientist on the team, and I have my graduate student, Owen Harrington, helping with the focus groups. And then the team of geoscientists is led by Dr. Sue Brantley. So it was really great in the design of the focus groups. Thankfully, Professor Brantley's student, Sam Sahin, who I believe was joining us for a bit today, he was able to attend 2 of the 3 focus groups. So it was really awesome to have him there and ask some follow-up questions, because things that Owen and I would capture, might not ring a bell for us, but then to Sam, that could be a sign for, oh, it could be this possible contamination pathway, or we need to look at the database for this particular species based on what the communities were saying. And then having Sam there in real time, there were some questions from the focus group attendees who were quite knowledgeable and very concerned about what they were seeing in their communities. So they had some pretty technical questions about how water testing is done and why DEP does it this way. And it was really great to have Sam's technical expertise in the room to answer that in real time, because Owen and I would not know that off the top of our heads.
Great, thank you. Dr. Malin.
Yes, thank you. So one thing that's been really interesting working on an interdisciplinary team, I think, has been looking at the environmental health results that have been kind of privileged, right? Like the air monitoring has been at the front end of community meetings we've had and those sorts of things. But when we get to the Q&A with community, right, what's really affecting people, I think, are what the questions at the end of the day are about: what to do to mitigate risk, right? How to deal with some of the psychosocial impacts of chronic exposure and those sorts of things. So what I really appreciated in this kind of interdisciplinary approach is that we could, all of the kind of researchers at the table, right, can bring things in that help give more satisfactory, grounded responses to folks who live in the midst of this sort of kind of onslaught every day, right? Rather than having these kind of upper level scientific findings that are not translated and no real empowering message for what folks can do. And so that's been a really cool aspect of the interdisciplinarity, I think.
Thank you, Stephanie. And Dr. Eggers, I guess I'll leave it to you to decide who answers the question, maybe all of you, although our time is limited, but you or Mr. Doyle or Ms. Lefthand.
John, why don't you start?
How it's impacted our communities is we don't have sewer standing in pools in our town areas. We don't have raw sewage running into the Little Bighorn River as it did at one time. We couldn't have done that without that collaboration and the knowledge that we gained from the science. And so the issues that we have dealt with may not be visible to most people because all of our the efforts are underground. They're pipes that that brought that sewer into you know, a pipe instead of it being surfacing in the ground. So that's the real impact that I've seen first. But I also know that our rural homeowners have benefited greatly. That just the knowledge that they've gained, and because we not only go to their house to test, but we go to visit as well. And that's a big part of that, is making certain that our homeowners understand all aspects of the research that is going on and the benefits that come with that. Did you have something to add to that? Go ahead, Maury.
Well, I think you want this to both, you know, benefit the community and make a difference on the ground and do better science from a Western perspective. You have to do it all together. You need all these kinds of knowledge and you need all these partners. I'll just give a couple examples on the science side. And doing the climate change research, you know, there's only one weather station before this new one that John put in. There's only been one weather station on the entire reservation, 2.8 million acres or something. And when the person who volunteered to man it finally, retired, that data source went away. And there's, you know, a neighboring one in Hardin, but the Western record of climate change impacts on the reservation is really, really scarce. And what we found from doing the interviews is everything the weather stations recorded, the community could, you know, was also telling us the exact same things, but they went way beyond in all kinds of other ecosystem impacts that there's no Western science data on. For instance, changes in spring breakup, and what's changed and how there aren't the ice breakups that there used to be, the changes in the flood patterns, there's changes in bird species and plant species, there's changes in which species of fish are living where. There's a huge long list of ecosystem changes that Western science hasn't been reporting whatsoever. So just as one example.
Great, thank you.
Hi everyone, and thank you so much for these presentations. I know that you're all covering like a huge territory and lots of, there's just so much more you could say about these projects than you have time for. So it's just wonderful, and so glad all the audience are here. I want to point to a couple of common themes that are coming up in the questions from the people online. And one of them has to do with strategies for sharing information from the projects back with community. And we have heard specifically a couple of great things already mentioned. There's a lot of time obviously spent by the Crow Environmental Health Steering Committee just in conversation. There is the ability in the Suncor project to really respond directly to people's concerns raised by the research findings. But I think, again, starting with the Pennsylvania project, any specifics that you can offer for the audience about the kinds of strategies for sharing information back, whether that's the content or the medium or other features of engagement, any highlights you want to share from your project, or even things that haven't worked that you wouldn't do again?
Yeah, thank you. So we're going to do follow-up focus groups later this summer, because one of the important things that I try to be mindful of is, going back and making sure that this is a continuing relationship with the communities and thanking them for their time. So we're going to do follow-up focus groups next month to share these preliminary results. But then another thing I do is I run the Shale Network workshop here at Penn State, which is a multi-stakeholder annual small group workshop that tries to bring together folks from around the state, government officials, industry officials, community officials, to speak about what they're seeing in terms of the environmental impacts of unconventional energy development, and then work towards, that solution side of the equation. And so this year, I feel very honored that I had enough funding, in part thanks to HEI, to bring some of the community members that really helped us get these focus groups off the ground. I was able to bring them here to University Park for this workshop. And then our keynote speaker was the just today appointed the new Secretary of the Department of Environmental Protection. He came 2 hours early before his keynote, and the community groups that came were able to speak with him one-on-one. And so one of the main findings from our focus groups last summer was that the DEP has been MIA, and they haven't had a connection to the government to share their concerns. So hopefully, and being able to speak one-on-one with the DEP secretary for a little bit of time, that helps to alleviate at least that part of the concern.
Okay, Dr. Malin.
Yes, thank you. So one of our approaches, I think, consistently has been kind of order of operations in terms of how we're processing and analyzing and sharing ultimately the information that we've learned from community members, right? So one of our big approaches has been to make sure that we have community meetings prior to any sort of publication or even just press releases or things like that around the information that we're learning, both out of respect for community and that we want the design to be as reciprocal as possible, right? And so folks have given us their time. We don't want to just be extracting knowledge and information from them and not sharing it back with community before anyone else kind of knows what's going on. But it's also allowed us to kind of check the validity and reliability of what we're finding, right? Is this resonating with folks who live in community? And it's allowed us to have a bit more of a set of network samples kind of going on even from those communities. So again, we try to share information as an interdisciplinary team in the language of the folks that are the primary language, which in this case is Spanish. So that folks coming to community meetings feel as included as possible. And again, getting information from the air quality folks and from the social scientists as well, and having Cultivando kind of lead those efforts as a really strong liaison, right, among academic researchers who always feel a little aside or outside of community, right? And maybe unapproachable to some folks. We've also kind of staggered how we're doing the work. So we've completed the interviews as the air quality monitoring is going on. And now we're kind of neck deep in the photo voice component of this, which was the kind of collecting photos and narratives of those photos in terms of how they've impacted quality of life, health effects and things like that. And it helps give us a visual image. It has made the process a bit more iterative. So responses we were getting during community meetings, we could kind of address those in photo voice, and we'll be doing focus groups related to photo voice participation later in the fall. So I think that both the sharing information in as reciprocal a manner as possible, as early as possible, and frequently, right? So that we're having frequent community meetings has been really important, as well as kind of staggering how we collect information.
Thank you. Do you, Mari, want to start on behalf of the Crow Environmental Health Steering Committee, talking about this issue of how to engage in the process of sharing research findings?
I agree with everything you both have just said. We're just trying to do also, besides a lot of just one-on-one report back, is to do community open houses. And as you've discussed, I just want to give a call out to Jamie Donatudo, who works with the Swinomish community. She and her team do a wonderful job doing community focus groups, and we've really learned from her to have a hands-on, engaged part of it, not just get up there and talk with people. And we're learning how to do that better. And I would say something that hasn't been mentioned is we have a real commitment to mentoring pro youth from fifth graders all the way up to PhD students, and sharing with those students and encouraging them in their education, then mentoring them in research and involving them as student members of our steering committee. That's also a really important way of sharing back. And our One of our longtime mentors is about to finish her PhD in soil and water science, and she'll be the first tribal member with a PhD in that discipline. So we're excited to have her home again and ready for her to start taking on a leadership role. And John or Myra?
Well, how we share our data, a lot of it depends on how well we're listening to our community and that we're following their lead. And we do have those gatherings where the public can come and join the discussions, but a lot of my personal is home visits and listening to the homeowners and taking their direction. And I don't think that we would be able to do that if we didn't have the connections that we have. And as Myra has pointed out, that, you know, we've lived here, we live in this community. Our community is pretty large. It's not just the towns. We have 6 small towns and 6 districts, and that's 100 by 80 miles roughly in distance. And we're related and connected to folks in every one of those locations. And so that sharing of information might be one-on-one, but it also travels through the community with those conversations that are held also.
I might be able to squeeze one last question in. Dr. Voorhees, do you want to take that away?
Sure. I am trying to decide which one to ask in the chat. There are so many. There's one related to the question you just asked that from a participant saying, you know, in sharing these learnings, there can be concern, right? Community can become concerned about the findings. And how have you addressed that in the sharing of data and findings to be sure that they comprehend it and you do not cause undue concern? There may be a real reason for concern, but not cause undue concern through miscommunication. And I think that's a general question for everyone. And we have 1 minute left.
And so Penn State's a land grant institution, so we have extension agents all over the state. So I have worked carefully with the extension teams who thankfully have the time to do more community engagement work. So we have talked with them for how to vet our feedback in a way that doesn't raise alarm. Because I mean, we're hearing concerns about cancer, so we don't want to come back and say something that might trigger folks and do that harm. So that was an excellent question, and I appreciate it.
15, 20-second answers from anybody else? I think we have like 1 minute and I've got to turn it back over to Ayusha to wrap us up. But
I will say from another land grant university perspective, we do have a lot of mechanisms in place for that, but I think they vary drastically by state. And I would say that report back and the barriers that can be created by well-meaning processes like the IRB could really be improved for community-based work so that that part of this can be as effective and useful for community as possible.
I would just add that we are always aware of that possibility of frightening people. And so the communications are very important to us, that we don't just tell them there's a problem and leave. We're always available to them. And by always being available, that's every day. And it doesn't matter where we're at and what situations, there's always time for that conversation.
It also means really putting effort into helping find solutions. So we're able to distribute home water coolers for free. So that lets people refill those 5-gallon jugs wherever they can get clean water for far cheaper than buying cases of bottled water at Walmart. And we also collaborate with the nonprofit Plenty Doors who's been able to raise $1 million so far to help people with home plumbing repairs. So you have to do something about the solutions. There's no point in getting people worried about these things if you don't have something they can do proactively to help reduce their exposures.
thank you so much for these observations, and we really appreciate it. Okay, I do unfortunately need to turn it over to Ayusha to wrap up this webinar, but thanks again to all the speakers.
Thank you so much, everyone, for attending this webinar. And as the moderators discussed, there are so many things that were covered in this webinar. So thank you for all your questions and comments. And please do complete the feedback survey in the chat, and we will be following up with you at a later date. We appreciate your feedback and hope to see you at our next webinar. Thank you.